This government has been lamenting the fact that financing of healthcare services is becoming prohibitive to many families, the majority of families. And it is something that concerns us. And we see the amount of money the Ministry of Health is spending on healthcare, pharmaceuticals. As a matter of fact, in this budget coming up, they're making a request for an additional amount to be included on top of what has been provided in the past. And the number of people who have to fetch medical care out of Dominica, the cost at it. And you know, doctors these days and hospitals these days, you have to pay them before the intervention is made. You know, before you do the surgery and after you pay. Now, if you do not have the money, you will not get the care that you need in many parts of this world, and the Caribbean and Dominica in some cases included. And I'm not talking about the hospital, but in the region and extra-regionally. And it's expensive. And this is why we have been saying that we need to look at some means of financing healthcare, especially for those of us who do not have the means of accessing or contracting medical insurance. So we have written to PAHO, we have been in consultation with PAHO over a period of time. And PAHO has sent to us now a delegation of experts to speak to various stakeholders in the country, not only the Ministry of Health and the Ministry of Finance and so forth, but to speak to various stakeholders, to gather the information and to advise us on some options that we can consider with regards to a national health insurance scheme or the financing of healthcare services. So we welcome the effort and the assistance of PAHO. We thank them. PAHO has been for many years, many decades, a great partner in healthcare delivery in Dominica. So we want to thank them for this offer of assistance with those technical persons, experts who are here to examine this. This is a priority for the Minister for Health. This is a priority for the government because we see it every day, and it's something that we have to bring head on. Some years ago, I had suggested, you know, those of us who are working, should we not develop a trust where, you know, 0.5% or 1% of our salaries could go to the trust that could help improve the quality of equipment at the hospital, or in some cases where you need to go overseas, that trust could facilitate you and so forth. It's something that I put in the public. It was no decision on the government, but it's something I placed and something that I will be drawing to the experts' attention as to my own respectful view on how we can go about financing healthcare. But we have to help those who are unable to finance it. And as I've said before, I believe I addressed this at the last press conference, because for me I feel so passionate about it. You know, I am very concerned about it. Because of the number of people that I have seen, I have met, and who have come to us for assistance within the government system. So the government is committed to addressing this. And we hope with the advice of the experts, we can find a solution to the challenge. But those of us who are working must be able to help those who are not. And it is something that we would like to support and understanding of the public. Because I have seen people who have money, so to speak, become broke because of their health situation. So yes, you may have money now, but tomorrow you may not have, and you may very well be a beneficiary of the National Health Insurance Scheme if we're able to, with the help of God, to put it together.